Welcome to the University of Minnesota. Join us on this virtual tour of our pathology department, guided by our very own residents, while we highlight what makes our program a fantastic and fun place to train. This tour will focus on our East Bank campus, where residents spend a majority of their time. Residents also rotate at our pediatric West Bank campus across the river, VA Medical Center, Abbott Northwestern Hospital for a private practice setting, and the Hennepin County Medical Examiner's Office. Electives are also available at the Jesse Edwards Heart Registry and Hennepin County Medical Center.
Welcome to our gross room. It's located right across from our surgical suites here in the main hospital. As you can see behind me, we have about 5 grossing stations and 2 cryostats, and we receive around 37,000 surgical specimens a year, ranging anywhere from small biopsies to larger complex resection specimens. As residents, we're regularly in the gross room, and we gross on almost every anatomic pathology block. We use Epic Beaker for our EMR and Dragon for our voice dictation. We follow a 3-day sign-up schedule where we work on biopsies and other small specimens on day 1 and bigs on day 2. And then on day 3, we gross and are responsible for frozen sections. Honestly, I think a secret gem of our program is that we have 5 pathology assistants. They rotate between our East and West Bank campuses and also our clinic and surgery centers. And even the morgue. We even have a PA student as well. Our PAs are highly involved in our resident education, and they frequently give us didactic lectures, and they're always ready to offer us guidance and assistance with our grossing. They're very fun to work with, and they're dedicated to making sure that we have an engaging and educational grossing experience. And here's our frozen section room, which is connected directly to our gross room. And here we look at frozen sections with our attendings and provide intraoperative diagnoses to our surgical colleagues.
A majority of our anatomic pathology department is housed in this AP hallway, which is located on the same floor as our gross room. One side of the hallway is lined with our attendings offices, and the other side has our central AP office where we pick up our cases in each subspecialty box throughout the day. Next to the office is a break room that has microwaves and 2 large refrigerators. At one end of our AP hallway is the entrance to the main hospital, and down at the other end is our cytology trainee office, where our 2 cytology fellows and rotating residents work on cases. Kitty corner to this office, we have the Benson conference room, which has a 5-headed scope, as well as 2 large TVs that we use to project images for our didactics, AP Consensus Conference, and Journal Club. Adjacent to the Benson is our larger multi-headed scope room where we commonly sign out cytology cases with the faculty. In total, we receive about 9,500 non-GYN and 3,500 GYN specimens a year. Next door to the multi-headed scope room is a surgical pathology resident and fellow room where we work through cases.
Hi, this is our morgue, which was just remodeled a couple of years ago and equipped with new equipment and 2 autopsy stations. We have an average of 150 autopsies per year at the university, and it's really easy for us to reach our required 30 autopsies to sit for the boards, since we have 3 dedicated autopsy months here throughout our residency. We also spend a month at the Hennepin County Medical Examiner's Office, one of the best ME offices in the country, for a dedicated forensic rotation and perform a few autopsies at the VA. We are spoiled as residents since we have a decedent care specialist that assists us with autopsies at both the VA and the university. They are really fun to work with, and we learned a lot from them.
Here is our transfusion medicine room where residents spend at least 4 months, 3 months in transfusion medicine and blood banking, and 1 month in coag. We also have a cell therapy elective rotation, which is exciting as we are a huge transplant center, and the U of M is known for innovative stem cell and cell therapy research. When we rotate through these blocks, we work closely with our faculty, whose offices are just around the corner, and our fellows that share this office with us. We help supply appropriate blood products to patients, whether for surgery, inpatient needs, or massive transfusion protocols. And we are very involved in managing our therapeutic apheresis patients. Transfusion medicine, coag, and cell therapy are very strong in our program, especially since our department is nationally recognized and our attendings are prominent leaders in their fields.
Our apheresis clinic is located at the recently built Clinics and Surgery Center. It's just a 5-minute walk or short shuttle ride, which is very nice in the winter, from the main hospital. We also go to the CSC for cytology to perform FNAs.
Our flow lab has its own dedicated room for trainees to gate paces, which is fantastic as we share the space with our very talented flow technicians that love to teach residents.
Here we are in the molecular laboratory. We have a versatile and good-sized molecular lab, which does multiple techniques and molecular testing for solid tumor and hematological malignancies. We do NGS-based testing, as well as smaller PCR-based testing for things like minimal residual disease, finding targetable alterations, HPV phenotyping, and chimerism engraftment studies for post-transplant follow-up. What's also very exciting is that we are allowed to really tailor a residency to our interests, so we can have several additional months through elective time to gain even more one-on-one teaching from the molecular faculty and hands-on experience. A small added bonus and unique to the molecular trainee office is we also have adjustable desks.
Our first floor residence room is used by residents on several CP rotations, as well as those who need a workspace for research projects or those on autopsy. Everyone has a locked cabinet for storing personal belongings and slides for research. There's also a fridge, microwave, Keurig, and a plethora of books, and everyone has their own mailbox. Here are our brand new call rooms that opened in early 2021. The call suite includes rooms that you can check out and access using an app on your phone, a kitchen area, as well as a gym. It's a beautiful facility that we're very fortunate to have access to. Though our call schedule typically doesn't demand that we stay on site, it's convenient for those who live a bit further away, or if you know that a late specimen will be coming in and you want to be here when it's ready. We also have the Health Sciences Library for medical students and residents, which recently moved into the newly constructed Health Sciences Education Center.
Located next to our building is Kaufman Memorial Union that contains multiple restaurants, both fancy and normal quick food spots, coffee shops, and even a bowling alley and movie theater downstairs. In fact, the Mayo Building and Kaufman are both located off of Washington Avenue, which contains even more dining options and a light rail train stop that drops you off right outside the hospital. Finally, remember how we said we are spoiled? We have free parking at every site we rotate at. Even better, we have underground heated parking at our main campus right next to our department. We don't even have to step outside in the winter because the garage is also connected to our building. Thank you for joining us on this tour of our campus. We hope you learned a lot about our facilities and our program, and we hope to see you next July.